I've performed over 2,000 knee replacements, and I can tell you this, the patients who avoid my operating table all do one thing differently. They train their knees backwards, not forward, backwards. It sounds crazy, but the science is overwhelming, and I'm about to prove it to you. I'm an orthopedic surgeon specializing in knee injuries and joint replacement. For the past 18 years, I've operated on thousands of patients with severe knee pain and arthritis. And I've noticed a clear pattern. The people who end up needing surgery are almost always doing the same thing. They're training their knees exclusively in forward movements. Walking forward, climbing stairs forward, lunging forward, and their knees keep getting worse. But there's a small group of patients who come to me with knee pain, follow my protocol, and never need surgery. What's their secret? They train backwards. Let me explain why this works and why almost nobody talks about it. Your knee is a complex joint with multiple moving parts. You have your femur, the thigh bone, sitting on top of your tibia, the shin bone. Between them is cartilage that acts as a cushion. Around the joint, you have ligaments for stability and muscles for movement. The two most important muscle groups for knee health are your quadriceps on the front of your thigh and your hamstrings on the back. Here's the problem. When you walk forward, climb stairs forward, or do forward exercises like regular lunges, your quadriceps do most of the work. Your quads extend your knee and push you forward. But this creates a specific type of force on your knee joint called anterior shear force. Basically, your femur slides forward on your tibia with every step. This is normal and not a problem when you're young and your cartilage is healthy. But after 60, your cartilage has been worn down by decades of use. That forward sliding motion creates friction and compression on damaged cartilage. Every forward step grinds it down a little more. The pain you feel is inflammation from that friction. Now, here's where backward movement changes everything. When you move backwards, the mechanics completely reverse. Instead of your quadriceps doing all the work, your hamstrings and glutes become the primary movers. And instead of anterior shear force pushing your femur forward, you get posterior shear force that actually pulls your femur backward. This creates space in the joint. It decompresses the cartilage. It reduces friction. And it allows your knee to move through its full range of motion without grinding bone on bone. There's research to back this up. A study published in the Journal of Orthopedic and Sports Physical Therapy compared forward walking to backward walking in patients with knee osteoarthritis. After 6 weeks, the backward walking group had a 67% reduction in pain. The forward walking group had only a 19% reduction. The backward walking group also showed significant improvements in quadriceps strength, functional mobility, and quality of life. The forward walking group showed minimal improvements. This wasn't a small study. They followed over 100 patients. The results were clear. Backward training works better. Another study from the American Journal of Physical Medicine looked at the biomechanics of backward versus forward movement. They used motion capture technology and force plates to measure exactly what's happening at the knee joint. What they found was fascinating. During forward walking, peak compressive force on the knee was about 3 times body weight. During backward walking, it was only about 1.5 times body weight. Half the compression. That's huge. They also found that backward walking activated the hamstrings 40% more than forward walking and reduced the load on the patellofemoral joint, which is the kneecap area where most people feel pain. So, why isn't everyone doing this? Honestly, I don't know. It's not taught in most physical therapy programs. It's not common knowledge among doctors. And it sounds weird. When I tell patients to walk backwards, they look at me like I'm crazy, but the ones who try it come back amazed. Their pain decreases within days, their mobility improves within weeks, and many of them avoid surgery altogether. Let me give you a specific example. I had a patient, 68 years old, with severe osteoarthritis in both knees. She could barely walk 1 block without pain. She couldn't climb stairs. She couldn't garden, which was her favorite hobby. Her x-rays showed bone-on-bone contact in the medial compartment of both knees. Most surgeons would have immediately scheduled her for bilateral knee replacements, but I told her to try something first. Walk backwards for 10 minutes every day. Do backward step-downs 3 times a week. Give it 8 weeks. She was skeptical but desperate, so she tried it. She started by holding onto a railing and walking backwards in her hallway, just 5 minutes at a time. It felt awkward at first, but within 2 weeks her pain had decreased noticeably. Within 4 weeks, she could walk a full block forward without pain. Within 8 weeks, she was gardening again. She came back for her follow-up appointment and told me she didn't want surgery anymore. Her knees weren't perfect, but they were functional, and that's all she needed. Now let me teach you exactly how to do this safely. There are 3 backward exercises I prescribe for knee pain: backward walking, backward step downs, and backward lunges. I'm going to explain each one in detail. Exercise number 1 is backward walking. This is the foundation. Find a safe space where you can walk backwards without obstacles. A hallway works perfectly. A quiet street or park path also works. Start by standing tall with good posture. Look over your shoulder to see where you're going. Don't twist your whole body, just turn your head. Now step backward with one foot. Land on the ball of your foot first, then roll back to your heel. This is the opposite of forward walking, where you land heel first. Push through your entire foot to step back with the other leg. Keep your steps short and controlled. Don't rush. Your arms should swing naturally, just like in forward walking. Keep your core engaged and your back straight. Don't lean forward or backward. The key is control and smoothness. Start with just 5 minutes of backward walking. You can break this into 1-minute intervals if 5 minutes feels like too much. Walk forward for a minute to reset, then walk backward for another minute. Do this 3 to 5 times per week. As you get stronger and more comfortable, increase your time to 10 minutes, then 15. Some of my patients eventually do 20 to 30 minutes of backward walking and report that it's more effective for their knee pain than any forward exercise they've ever done. You can do this on a treadmill if you prefer. Just hold the handrails, face backward, and set the speed very low. Start at 0.5 or 1 mile per hour. Safety first. Exercise number 2 is the backward step down. This is more advanced but incredibly effective for building knee strength and control. You'll need a step or a stair. Start by standing on the step facing away from the edge. Your feet should be hip-width apart. Slowly lower one leg down behind you toward the ground. The key word is slowly. Take 3 to 4 seconds to lower down. Keep your weight on the leg that's still on the step. Don't just drop down. Control the descent using your hamstrings and glutes. Touch your toe to the ground lightly. Don't put weight on it. Then push back up to the starting position using the leg on the step. That's 1 repetition. Do 8 to 10 reps on one leg, then switch to the other leg. Do 3 sets on each leg. This exercise is phenomenal for building eccentric strength in your hamstrings and glutes, which protects your knees. The eccentric phase of muscle contraction, which is the lowering or lengthening phase, is where you build the most strength. Forward step-ups work the concentric phase. Backward step-downs work the eccentric phase. And eccentric training has been shown in multiple studies to reduce tendon pain, improve joint stability, and accelerate cartilage healing. If backward step-downs feel too hard, start with a lower step. Even a 4-inch step works. As you get stronger, use a higher step. Exercise number 3 is the backward lunge. This combines backward movement with single leg strength training. Stand tall with your feet together, step backward with one leg into a lunge position. Lower your back knee toward the ground. Keep your front knee aligned over your ankle. Don't let it cave inward. Push through your front heel to return to standing. That's 1 rep. The backward lunge is safer for your knees than a forward lunge. Because when you step back, your front knee stays stable. In a forward lunge, your knee travels forward past your toes, which increases compression. In a backward lunge, your knee stays behind your toes, which reduces compression. Do 10 lunges on each leg, 3 sets. You can hold light dumbbells for added resistance once the bodyweight version feels easy. Now let me talk about why this works on a deeper level. When you train backwards, you're not just reducing joint compression, you're also retraining your neuromuscular patterns. Most people with chronic knee pain develop compensation patterns. They shift their weight away from the painful knee. They avoid bending it fully. They use their other leg more. These compensations create muscle imbalances. The muscles around the painful knee get weak. And weak muscles mean more stress on the joint. Backward training forces you to use your muscles differently. It activates underused muscle groups. It improves coordination. It restores balance between your quads and hamstrings. Over time, this corrects the imbalances and takes pressure off the damaged cartilage. Your muscles start doing their job of supporting the joint, and the joint experiences less wear and tear. There's also a proprioception benefit. Proprioception is your body's awareness of where it is in space. Good proprioception means good balance and good joint control. Bad proprioception means instability and increased injury risk. Backward movement challenges your proprioception because it's unfamiliar. Your brain has to pay attention. Your nervous system has to adapt. And this adaptation improves your overall knee stability and control. I want to address safety because I know some of you are thinking this sounds dangerous. Walking backwards, stepping backwards, won't I fall? Yes, there's a risk, which is why you need to start in a controlled environment. Use a hallway with walls on both sides that you can touch for balance. Use a railing or a sturdy piece of furniture. Clear the floor of any obstacles. Look behind you before you start. Take it slow. There's no rush. If you have severe balance problems or a history of falls, do this exercise with someone else present, or do it holding onto a countertop or walker. You can even do seated backward leg slides if standing backward movement feels too risky. Sit in a chair and slide one foot backward along the floor as far as you can, then return it. This provides some of the same benefits without the fall risk. Let me also talk about progression. Start with backward walking 5 minutes, 3 times per week. Do this for 2 weeks. If your pain decreases, add backward step downs. Start with a low step and just 5 reps per leg. Do this for 2 more weeks. If you continue to improve, add backward lunges. 5 reps per leg. Build up gradually over 8 to 12 weeks. By the end of 3 months, you should be doing 15 minutes of backward walking, 3 sets of 10 backward step downs, and 3 sets of 10 backward lunges. This routine takes about 25 minutes and can be done 3 times per week. Now I need to be clear about expectations. Backward training is not a miracle cure. If you have severe bone-on-bone arthritis, if your cartilage is completely gone, if you have major structural damage, you might still need surgery eventually. But even in severe cases, backward training can reduce pain, improve function, and delay surgery by months or even years. And for people with mild to moderate knee pain, backward training can be genuinely transformative. I also want to emphasize that backward training should complement, not replace, other good habits. You still need to maintain a healthy weight. Every extra pound you carry puts 4 additional pounds of pressure on your knees. Losing 10 pounds takes 40 pounds of pressure off your knees with every step. You still need to eat an anti-inflammatory diet, rich in omega-3 fatty acids, vegetables, and lean proteins. You still need to stay hydrated. You still need to get enough sleep. Backward training is powerful, but it works best as part of a comprehensive approach. Here's my challenge to you. For the next 8 weeks, commit to backward training 3 times per week. Start with just backward walking, 5 minutes per session. Track your pain level on a scale of 1 to 10 before you start and after each week. I'm willing to bet that by week 4, your pain will be noticeably lower. By week 8, you'll have better mobility and less daily discomfort. And you might just avoid ending up in my operating room. Drop a comment and tell me your current knee pain level on a scale of 1 to 10. Then commit publicly to trying backward training for 8 weeks. Come back and update us on your progress. I want to hear your success stories. If this video helped you, hit the like button and subscribe. Share it with anyone over 60 who's dealing with knee pain. This information could save them from surgery and give them their mobility back. Your knees don't have to get worse. They can get better. Start walking backwards today.